I'm Maxar Haribov. I'm here at Digital Health Summit Studio with Barrett, Larson from Leaf Healthcare. So tell me a little bit more about Leaf.
Sure, yeah, I'd be happy to. So Leaf Healthcare, fundamentally what we do is we have a simple solution for monitoring patient mobility protocols, so specifically for hospitalized patients. Not many people are aware, but patient mobility is actually very important. So interestingly, this concept of bed rest has been ingrained into the fabric of nursing care really for millennia. Mm-hmm. But in the last 5, 10, 15 years, there's been a tidal wave of research that has supported actually patient mobility and is allowing us now to kind of depart from that outdated practice. And the problem is, although we know that mobility is important and it prevents a number of hospital-acquired conditions, if you don't have a way of effectively and objectively and reliably monitoring that metric, it's difficult to manage. And that's what Leaf does, is we provide tools to allow hospitals to very effectively manage mobility metrics.
That sounds important. I hear that the activity or relevant activity of a patient does correlate to how well they recover. So how do you guys actually do that on the ground level?
Yeah. So what we do is, let me give you a specific example. So the first application for our technology was for pressure ulcer prevention, pressure injury, bed sores. Many people aren't familiar with this problem, but it's actually very common. So about 3.6% of patients that walk into a hospital will end up getting a hospital-acquired pressure ulcer. And these things are horrible. So they're a source of significant morbidity and mortality for patients. They cost the United States healthcare system about $10 billion every year, which is just, it's shocking. And the thing is, it's no mystery how you prevent pressure ulcers. It's actually very simple. All you do is you make sure that patients are moving and turning and repositioning on a regular schedule. And you and I, when we're sleeping at home, you actually are doing these micro movements. You're turning, you're responding to those pressure cues subconsciously and making sure that pressure is not building up. But patients in the hospital, these patients are almost by definition sick. They're elderly oftentimes, they're medicated, they're delirious, and they don't respond to those normal pressure cues. And as a result, they're at risk for these pressure ulcers. And they're literally at the mercy of the nursing care. So the nurses have to go in there and make sure that those patients are actually not staying in one position for too long, that they're turning and moving and repositioning. And historically, these turning protocols, as they're called, were coordinated in a traditional fashion using just pen and paper or musical cues and chimes overhead. Really a system that was not that effective. There was no layer of accountability. It was inefficient in that oftentimes patients would move on their own, and because it wasn't witnessed and documented, it essentially didn't happen, at least as far as the record's concerned. So nurses would need to go in there and turn those patients that were actually already turning effectively. Wow. So what Leaf does is provide very high resolution position data, constantly monitoring every patient at risk for pressure ulcers, analyzing the pressure distribution on the patient's body, and distilling all of that information down into a nice concrete message to let nurses know if any particular patient needs to be repositioned in order to prevent an injury.
Interesting, that's very actionable. So is there something that you're excited about this year?
Yeah, there's a lot. This year is especially interesting for Leaf in that the product is now evolving, and the system is now able to coordinate care throughout the entire mobility spectrum. So we started with monitoring patients in bed and making sure that patients in bed were fully mobilized. Now we're actually taking it a step further, and we're monitoring ambulation metrics. So there's a number of protocols installed in hospitals that dictate who needs to get out of bed, how often they need to get out of bed, how far they need to walk, and these are actually prescriptions. These are things that a physician or a nurse or a physical therapist will prescribe a patient. And it's difficult to really know whether or not that prescription is being followed. And traditionally, the only way of knowing if it's being followed is just having somebody watch and see if a patient walks and then manually document that. But now with this type of technology, we can capture every ambulation event. We know exactly how far the patients are walking. Are they getting better? Are they getting worse? Are they walking more? Are they walking less? So that is a really interesting evolution of the product.
That's very much needed, I think, in our healthcare system today.
Yeah.
Well, thank you so much, Barrett.
Sure.
And this is Aksar Haribov coming to you live from Digital Health Summit Studio.